Isn't it? Bit of a growing forest in there. G'day guys, Jason here. Today I'm going to show you a quick treatment for sciatica. So if you're getting nerve pain down the legs, you might be experiencing pain in the calf or in the hamstring, or even sometimes down the front of the leg, we're going to show you a quick treatment how we're going to fix that for you. So just relaxing your head down there, Matt. So you're going to start getting the glute attachments to the sacrum. So you're going to start to just treat off through there. So coming down nice and slow. This is a bit of a broader stroke just so you can feel what areas are tight and restricted. So there's normally a few points that we're going to focus on with this. So you're going to focus on the iliac crest attachments of the glutes, and then we're going to come around and get the ones off the greater trochanter, and then we'll get Matt onto his side and treat through TFL as well. So we've done a couple of warm-up strokes. Normally do a bit longer there, but for video's sake I'll just get into the elbow, show you the money stuff. So sinking in, so we're pushing down on those glute attachments. And just slowly tracing the sacrum, and then we're going to go around the iliac crest. Changing a few angles, so pushing back in. Searching for where your pain is or where you might feel it, so it can be just a slight change of an angle. Pushing back in, or we might go away. Just ever so slightly, feeling there's a good spot for Matt. And we're just trying to find a spot that might replicate your pain going down your leg. It might, sometimes can go up into the back as well. So if you do have tight glute medius and minimus, sometimes you can get a bit of pain in the lower back as well. So you can get a bit of relief from releasing this area. There you go, good one on Matt there. So just gonna find that spot and we'll camp out, sink in, so pulling back in towards it so that we can just slowly melt it and soften it up. There you go in there, Matty.
It's referring down the leg.
Down the leg, yeah, perfect. Following it all the way out. And we'll just do one more for video's sake so we can hit it a bit harder again. So sinking in again onto those sacral attachments. Couple of deep breaths there, Matt. And so if you've got sciatica or glute pain, you'll know that this is going to be a really effective treatment for you. If you're getting that ache in the glute as well, if you're sitting down a lot at work, driving in the car, this is going to be quite common for those sort of people. A few good spots in there for Matt, but we can feel already it's starting to release through there. And a good sign that it's releasing is the symptoms going down your leg will start to ease as well as the pain in the spot. Alright, so once we're happy we've hit them, I'll come around the other side. We'll get the trochanter attachments. So we'll battle on. And just slowly tracing around. So it can be a pretty nasty treatment, this one, but we want to stay within your pain threshold, so keep it between that sort of 7 or 8 out of 10. Occasionally might have to go up to 9 or 10, but not too often. We want to stay in that good pain threshold where we're getting the best results. So we'll tailor the pressure to how much you can handle. So yeah, if you've had sciatica for long periods of time, we might actually sit on this glute. We might treat through here for half an hour, just to make sure that we thoroughly hit all the good spots. because a quick 5-minute treatment isn't going to be what you need. You need to get in here, focus on this area, if this is where it's coming from, making sure we hit it and get rid of it.
Oh, that's such a good spot.
Yeah, that feels pretty nasty in there. And so again, we're going to trace all the way around that hip bone. Again, exploring, changing angles, sharpening my pressure, blunting it. Again, asking Matt for feedback. Who's getting any referral pain? If it's replicating your nerve pain.
A bit in the foot.
Bit in the foot. There we go. So we'll just push in a little bit harder. Just because I'm a bit of a sadist that way. So. And then the other important thing is sinking out really slowly as well, so that that tissue is able to relax and we're not really pulling out. Alright, so we're going to get Matt now onto his side and we're going to treat through his TFL. So this hip on top for us, Matt. This side? Yep. And then grab it up like here, so bottom leg straight and just bringing your top hip up there. So you might want to come around here, Ninja. We're just going to hit TFL through here, so this is another good one that can quite often refer a lot of pain down to the shin and ankle. And it's quite often pretty sore with people who suffer sciatica. Just going to ease in with the double thumb. Anything going down the shin there, Matt?
Feel the front of my foot.
Front of the foot, yep. There we go, so we're just going to sit on that one for a couple of minutes again.
Oh, fuck.
Again, we might spend 5 to 10 minutes on just TFL if we have to. For video's sake, I'll just sit here for another minute or so.
Fuck.
Loves it.
Oh my God.
Deep breaths, Matty. This one you'll feel, as soon as you get up, you'll actually feel the relief in this area, so it'll feel painful while you're getting it, but it's one of those areas that you actually get up and go, oh, your hips feel a lot freer already, so it's a pretty instant relief. Alright. So if you're suffering sciatica or any nerve pain down the leg, come in and see us and we'll help you out. Thank you. Oh, fuck.
Oh dear.
Oh dear, you